I'm doing great, Eric. Thank you so much for having me. And you actually did a great job in pronouncing my name, so I gotta give you a lot of props. It is Dr. Anuj Shah, so you got that right. But I'm not a cardiothoracic surgeon. I'm interventional cardiologist. So a little technical difference there, which I can't blame you for. But yeah, so what we differentiate, we love to actually call ourselves not cardiothoracic surgeon because unlike our surgeon colleagues, we don't open blockages like cutting the chest open. We do everything with minimal catheter-based technique that we are very proud of. So I would like to differentiate myself. But again, thank you for the warm welcome and absolute pleasure to be here. And let me preface this by saying I'm very excited and thank you for your service. Being a veteran, super proud of you and it's an amazing show that you've created. So glad to be here.
Well, Doc, I want to thank you for attending. When we started this show, we always devoted Thursdays to our first responders and our military. And I told my team, I said, you know what? I also consider our healthcare workers. You guys are our front line of defense during probably what my lifetime has been the worst pandemic I've ever seen and been through. So I was like, we're putting first responders and healthcare providers on here, which is kind of funny. Your guys' world blends here on this show because our first guest is you, who obviously is a healthcare provider, as a doctor. And our last guest is a New York City firefighter, retired, but his organization has been key in providing masks to first responders and healthcare providers in the tri-state. So kind of a cool day today. And in between, we've got some Marines and some Navy people and some Army guys to go in between just to make it a fun episode. But let's talk briefly about the coronavirus. Obviously, you're in the tri-state. We all, and I let in early in the news that there's so much data out there, right? And everybody's armchair quarterbacking everything that takes place with the pandemic. What is your thoughts? I'd love somebody who actually wears a white jacket and knows what they're talking about to kind of give us your opinion. Granted, I'm not going to say that you're the expert in it, but I'd love your opinion as someone who's been medically trained. What's your thoughts on where we're going and how bad this virus truly is?
Yeah, it's obviously very bad. Again, I am, one of the people who is dealing with the COVID-19 crisis from the beginning. As you said, it is probably the worst pandemic any of us has ever seen. It's the only pandemic in the last century, after the Spanish flu. So it's completely unprecedented, and the number of challenges that we are seeing, it's beyond the scope of like an individual getting COVID-19 infection, right? So we are talking about COVID-19 causing infection in one individual and person and the health crisis that comes at individual level. But then a way bigger crisis comes at the systematic level because it's creating an influx of number of really sick individuals in a very short span. So, and this actually proves the point that we are all human, humans are all connected, right? We live in a society and our fabric is so interwoven and connected that it's what I do and how I make decisions about my own life, healthcare decisions, as well as my social life decisions, impacts you and your loved ones. And that mentality we all need to cultivate and create. So I think so COVID is causing individual crisis. It is creating a crisis on healthcare in general, and then obviously the other financial and society related crisis. So as you said, I was listening to you earlier, and you said stop being quarterbacks, let Tom Brady and Gronk you handle that part, the football analogy they use. I think Anthony Fauci has been our quarterback, for example, you could say that. So in that debate, I would definitely support him. But the problem, that all of us medical professionals are dealing with is lack of data. This virus has come back so quickly. We rely on, when you believe in science, the problem is as a scientist, you need scientific data. And then, in absence of data, it becomes a little bit difficult to prove certain points. And I think that's why a lot of people are unfortunately losing their faith and trust over the scientific process. But I would love to remind everyone that, hey, it's time to pay attention back to science, be patient. I know everybody wants to go out and start living a social life and go back to business and be done with this COVID-19, but we need a little bit more patience, I think.
Awesome. Thanks for that, Doc. So let's talk about it because we're talking about getting back to normal, right? And so elective surgeries are a big topic of choice right now. They started the beginning of May. And I know you have pretty interesting feedback on this. So where do you think, where's that line with elective especially cardiovascular? Let's talk about that. Where's the line of where we do it? Because you know, in our healthcare domain, America's not great right now, and you actually have a reason why. So let's talk about that.
Sure. Yeah.
Go
So
ahead.
I think part of the problem is no surgery is truly elective. Right? Elective means that something could potentially wait a little bit longer, and then how much longer can a surgery wait is very debatable. Most states use the definition that if you can wait up to 3 months, it's considered a truly an elective surgery. Majority of the cardiac or vascular, which is circulation problem, those procedures and surgeries can really wait 3 months. You're talking about potentially someone's heart or limb. So even though it may not be an emergent surgery, it's not quite elective. So there's a huge gray zone in between, and in what we call the urgency. And you can, again, in football terms, you can punt the ball for you can punt the football only few times. So you can punt the surgery, say, okay, we'll reconsider that in 2 weeks when things get better. Reconsider in 2 weeks. Now we have patients and folks who are waiting, whose limbs are about to fall off, and they have been waiting for since like March, and their procedure and surgeries were delayed. So now those are considered elective, and now we started doing them from beginning of May. So that's where we stand. There's still a lot of people who have quote unquote stable disease, and we are still waiting to bring them and fix their blockages and stuff like that. So again, it's unprecedented time. On one side, you don't want to ignore people and folks who are dealing with this because you're worried about that they catch coronavirus, B, you take away the precious resources from the hospital and hospital workers. So it's a fine balance. It's a juggling act that we are learning to do. And I think this is why a lot of people compare medical professionals with the army. And one of the things I'm learning is, wow, what it must be at the battlefield, because it requires, you gotta look at the full picture. You can't just look at the enemy who's in front of you, which in this case would be COVID-19, but other enemies that come out, which is scarcity of resources, triaging, making sure who to and what to give priority, and making very important decisions in split second.
Awesome. Well, Doc, that's been some great insight into, I think it's important. People have been talking about elective surgeries. They've been talking about going back to simple things, like even going to your dentist, which was an elective for a long time. But let's also talk about, and it's the final thing I want us to talk about on this time. I'd love to have you back to keep, you have so many things we could talk about. But my final question for you is this. We've heard of different things that COVID-19 is affecting. From now we're hearing children are being affected. There's some new strain that's out there. But there's something called COVID toes. I know that you deal with a lot of amputations. I know diabetes, people that are diabetic are affected by COVID-19. So what's going on there?
Yeah, so COVID is actually a clotting disorder at the end of the day, hypercoagulable. So I'm a vascular specialist. I'm very passionate about preventing amputation. I'm very passionate about improving people's circulation. And one of the major things that we are seeing in COVID patients, and for whatever reason it's not getting that much mainstream attention, I would say, is COVID limbs, right? So COVID is causing this blood clots and blockage problem that's happening in leg veins as well as leg arteries. And we have one famous example of Nick Cordero, who unfortunately had to go for an amputation surgery because he had an ECMO catheter. But there are plenty of other people who ended up getting this massive blood clots in their arteries and veins and causing a lot of problems. So that's why COVID is bringing this vascular disease and circulation problem issue to the forefront. Having said that, I do want to mention, since you being veteran, the amputation rate and diabetic foot ulcers in general in veterans are astronomically high. Most people imagine that people who combat the war and combat the battle, if they end up losing their limbs, it would be because of combat injuries. In reality, large majority of the veterans in this country end up losing their limbs like rest of the population because of diabetes, diabetic foot ulcers, and serious circulation problems. More than 70 to 80,000 per year. The most unfortunate aspect of this is large majority of them, 80 to 90% of them are preventable. And this is what I'm very passionate about, because diabetic foot ulcers and amputation are next to death sentence. Once a person get amputation, their risk of survival is as bad as getting stage 4 cancer. And the cost and the burden that we are dealing with, it's tremendous. So I know VA is making some efforts in raising awareness about these issues. VA is making some effort in preventing. But if COVID crisis is teaching anything, that the circulation problems have to be taken very seriously and not wait till a crisis actually hits you. That's like saying your house is on fire and now you're thinking of having a fire alarm. I think the time to put a fire alarm is when things are quiet. So I think when people have leg pains, any discoloration, ulcers, especially if they're diabetic or they have blood pressure, cholesterol, smoking issues, we need to pay attention to their circulation, and because that's the name of the game. So I think everything is tied down. In my opinion, we are doing our best in helping COVID-related patients who get these tremendous blood clots. A lot of them could have been avoided had people addressed their underlying risk factors.
Awesome, Doc. Thanks for that amazing insight. And if you have time, we'd love to have you back on really soon again to keep deep diving in. You are fabulous. The guests on the side, they are just talking about how informative you are. And it's great. This is truly, I mean, to kind of go a little bit long here with you, it is truly good to finally have a doctor that we can ask questions to, because I think problem for the last 8 weeks is we haven't been given any true insight, because obviously it's hard to talk to your physician. They're not going to want to talk to thousands of people, but having folks like you, experts, come on and us be able to ask you questions and you give your professional feedback. You are a professional. It is so key. And I can tell you, all of the people who are tuning in right now are very excited to hear what you're sharing, that they're getting some good insight. They're like, finally, we're not getting that. We see fighting amongst everybody and turning it into politics. And that's not why you guys go to school. You go to school to save lives and make our lives better. So we thank you for that, Doc. So I want to thank you for coming on today. Let's have you back real soon. And I hope you have a great week.
Absolutely, my pleasure. And looking forward to coming back. Again, great forum. And thank you for your services. Thank you.
Thank you. Have a great day.